Senator from Ohio.
Thank you, Mr. President. I ask unanimous consent to vitiate the quorum call.
Without objection.
And I ask unanimous consent, Mr. President, to speak for up to 10 minutes as if in morning business.
Without objection, the Senator from Ohio is recognized.
Thank you, Mr. President. Yesterday at the James Cancer Hospital at Ohio State University in Columbus, the capital of my state, I announced legislation to eliminate needless barriers to cancer research. I was joined by Dr. William Carson, by Dr. James Thomas, by patients, by nurses who do the research and do the clinical care for patients during these clinical trials. Many of them have worked on this issue with Congresswoman Deborah Price, a Columbus Republican. Merle Farnsworth, a lymphoma patient from Beverly, Ohio, shared an emotional story about cancer clinical trials, meaning hope and possibly a life-saving cure for him and for millions of patients like him. The goal to both the House and Senate versions of this legislation is simple: to finally identify cures for this merciless killer. So many of us have been touched by cancer. We know, all of us, I would guess, in this room right now know someone with cancer, have lost someone to cancer, know someone who's living with cancer. Focusing on cancer yesterday at the James Cancer Hospital reminded me of what's at stake when we're fighting for broader access to health care. We're fighting to promote early detection of childhood cancers like Hodgkin's disease and leukemia and bone cancer. We're fighting to ensure that every woman can receive mammograms and pap tests. We're fighting to diagnose prostate cancer and colon cancer and skin cancer as soon as possible, the key to saving lives. We recognize that everyone should be able to get these preventive measures regardless of whether they live, or where they live, or how much they earn. We recognize that a woman with breast cancer without insurance is 40% more likely to die than a woman with breast cancer with insurance. We need a health care system that's affordable and inclusive, where insurance companies follow through on providing coverage to those who need it. No American should be driven into bankruptcy by a catastrophic illness like cancer. And no one should be denied access to clinical trials because insurance companies all too often try to drop them from coverage. Last year, Cheryl Freeman from Dayton, a retired school teacher, and her husband Craig visited my office in Washington. Cheryl had multiple myeloma. Cheryl and Craig brought to my attention the problems they were having with their insurance company. Cheryl was covered under Craig's insurance plan. Craig's been a federal employee for 20 years. Yet they found out that when Cheryl tried to enroll in a clinical trial to save her life, her insurance company wouldn't cover the routine costs of her care. If she had not enrolled in the clinical trial, they would have covered the cost of her care. She enrolled in the clinical trial, and the insurance company, for all intents and purposes, dropped her for the purposes of providing routine care for her. In addition to her clinical trial in Columbus, Cheryl needed to visit her oncologist in Dayton, about an hour and 45 minutes away, at least once a week for standard cancer monitoring, which included blood tests and scans. But her insurance company wouldn't cover these services if she enrolled in a clinical trial. Cheryl wanted to take part in a clinical trial because she hoped it would help her. She hoped it might save her life, give her more time, and further cancer research. But rather than devoting her energy toward combating cancer and participating in a clinical trial, Cheryl spent the last months of her life haggling with her insurance companies. The delays, the denials from her insurance company probably affected her treatment and probably affected her survival. Cheryl died on December 9th, 2007. The story could have ended differently. Cheryl and Craig should not have to sacrifice their precious time together trying to get the care she deserved, the care she paid for when she signed up for her insurance. The thing is, people invest in insurance when they're healthy so they have financial protection when they're sick. It's meant to cover the cost, obviously, of unanticipated health care needs. And whether a coverage exclusion like this one, which denies payment for unanticipated health care needs, is written into an insurance contract or not, it's still a scam. Unfortunately, Cheryl and Craig aren't alone. It's happening across Ohio. It's happening in the presiding officer's state of New Jersey. It's happening in all the 50 states. Some 20% of cancer patients who attempt to enroll in a clinical trial face the same problem with their insurance companies. It's because of stories like these that I'm introducing the Access to Cancer Clinical Trials Act this week. Similar legislation is on its way to getting passed in the Ohio State Legislature. The governor plans to sign that bill immediately, as soon as possible. My bill and Congressman Price's bill in the House ensures this protection nationally. The bill simply obligates health plans to pay for routine care costs when a cancer patient enrolls in a clinical trial. Something, frankly, we shouldn't have to tell the insurance companies to do, but when they drop coverage for people who have signed up for a clinical trial, it's what we have to do. These are costs that, as I said, would normally be covered if a cancer patient were not participating in a clinical trial. The legislation is specific in its definition of routine care costs and follows the Medicare definition. The bill will ensure that cancer patients and their caregivers can use their valuable time together to fight the disease instead of the red tape of insurance companies. In order to fight cancer and make progress, we need to further scientific advancement, not create barriers for patients who want to participate in life-saving research. I'm grateful to Merle Farnsworth for yesterday so courageously and passionately sharing his story with us and with the public. I'm grateful to the nurses who practice their clinical research and do their clinical care and practice their research for these patients in these clinical trials. I'm grateful to Cheryl and Craig for their courage in sharing their story. Their two children joined us yesterday in bringing this issue to my attention. Cheryl was already very sick when she visited Washington, D.C., and I imagine it wasn't easy for her to be traveling, but she did. She saw how important this issue was. I will keep the Freemans in mind as I advocate to get this bill passed. I'll work hard on this legislation so no one has to go through the kind of experience the Freemans have and the kind of experience that Mr. Farnsworth had. Instead of fighting their cancer, too many Americans are forced to fight their insurance company in the late stages of their disease. That's got to stop. That's why this legislation is so very, very important. Mr. President, I yield the floor.
The clerk will call the roll.